Welcome to the fourth video in the Connecting the Dots Caregiver Education series. In this video, our caregiver and healthcare provider presenters will talk about advocacy and health system navigation. We hope this information helps support and guide you on your caregiving journey. The presenters are Jody Lynn Taylor and Joan Ritzma. Jody Lynn is a caregiver for her grandmother and before that her uncle and mother. Joan works at the Star Family Health Team.
Advocacy refers to sharing your thoughts and ideas with others to bring about change. As a caregiver, there are many examples of when you might be in an advocacy role.
Speaking to a member of the healthcare team about concerns you have, like changes in the client condition or the quality of the services they are getting.
Explaining to a care provider that you are not comfortable with something.
Writing a letter to the government asking more caregiver support.
Providers look to patients and clients, their families, and their caregivers to understand what makes you, you. With this information, healthcare providers can make better recommendations for you and the care receiver about treatment and services.
For many people, finding yourself in a situation where you need to advocate for yourself or for someone else can be stressful. Fortunately, a simple tool can be used to help you communicate more effectively.
This tool is called SBAR, which refers to situation, background, assessment, and request. Caregivers and care receivers can use it too. The SBAR tool works like this. S, situation. You describe the situation. B, background. You provide any additional details that would be helpful for the health team. A, assessment. What do you think about this situation and how do you feel? And R, request. What are you asking for?
Here's an example of how it would work for a caregiver caring for their mother when they feel they can no longer care for her anymore. At the appointment with her family doctor to discuss options, you can structure the conversation like this.
The situation. I'm finding it too difficult to continue to provide care for my mother.
The background. She is becoming less willing to participate in her care and is much weaker than she used to be. My family has maxed out all available services and help.
The assessment. I think it is time that she be placed in residential care, or I'm not too sure what to do with her anymore to help her.
The request. Can you discuss options for finding somewhere she could live near us?
Our healthcare system is very complex. When clients, patients, and families in the Huron Perth counties were asked about their thoughts on the system, the ability to access care and navigate through it were identified as the key challenges. So what can caregivers do to find their way around the system? Here are some tips and suggestions that you can use. Organize, organize, organize. One strategy to help navigate the system is to keep a binder or a folder of all relevant health information that you can bring with you to your appointments. Be sure to check out the resources and tools in the Huron Perth section of the Caregiver Guide to find the Healthcare Journey Binder.
Ask questions to help you navigate the system, such as, who can I speak to if I have more questions? What are the next steps after this appointment? Will copies of my medical information be shared with other members of the health team? Are there any questions that I should be asking?
Don't be worried about asking for help. Check with your local health agency to see if they have a system navigator that could help you.
You can also seek out caregivers who have had a similar journey. They are a good resource and almost always want to share their ideas and advice with others. Plan ahead and start as early as possible.
Make sure to visit the resource website www.caregivershuronperth.ca to learn more and read the Caregiver Guide. You can also find a digital copy on the Caregiver website. Thank you.
Thank you for watching this video on advocacy and health system navigation. This series was co-designed by caregivers and healthcare providers like Jody Lynn and Joan. The Connecting the Dots project is funded by the Change Foundation and is a partnership of 6 healthcare organizations and caregivers in Huron Perth. We hope this information will help to make your journey easier and helps you feel more supported in your important role. Our next video will cover navigating financial and legal issues. Please take some time to watch them all.